And these were so 5 people are the ones who have died. You have been seeing in the press wonderful monitor newspaper, the one which works for the enemy. They have been proclaiming, I don't know how many have died, I don't know how many, but the people who have died here are 5. Now, the 24 confirmed cases. I don't know whether the 24 included the 5 who died or they included the 5. So 24 people confirmed, 5 of them dead. That means infected but not dead, 19. I'm sitting here with all the powerful people of the ministry. There's Dr. Jenna Cheng, there's Dr. Diana Twine, there's Dr. Mwewesa. From here you go to heaven. There's another place. But when you go from this, there's no other address. If you want health matters, there's no other place. Then I also have the Prime Minister here. I have Nanka Virwa to support my Uganda. And I have my young sister, Joyce Sebugwao, and some other powerful persons whom I don't have to disturb you with. So the people, the cases, and these people I saw on the Al Jazeera, quoting wrong figures from Monitor. So the case is 24 confirmed, 5 dead. 6 health workers, 4 doctors, 1 anesthetist, and 1 medical student exposed to the index case. What is index case? The first one. Between 15th and 18th, have tested positive to Ebola and are being managed at Mbende and Fort Portal referral hospitals. They are being treated. That's what, you know, when I read the document of the Minister of Health, I must keep localizing their word. Management as if they are managing a bank. For us in our language, we say they are being treated. They are being treated. The table below shows a breakdown of confirmed cases and death by district and sub-county. I have them here. Mubende, Madudu sub-county, confirmed cases 11, dead 5. Mbende municipality cases 5, dead nobody. Kasambia 1, 0 death. Chiviringa 1, nobody died. Chitenga 1, nobody died. Then in Chejegwa, Kasule sub-county, 3 cases, nobody died. Kasanda sub-county, 2 cases, nobody died. So 24 people infected, 5 are the ones who are dead. In addition to the Ebola 5 confirmed deaths, there are 19 individuals who died in the community after showing similar signs. Since they died at home, we do not have opportunity to test them. I'm told that the current transmission in Maduro sub-county in Mbende district and in other districts appears to be driven by exposure at barrios and family interactions following the death of people suspected to have succumbed to Ebola. This is the first time in more than a decade that Uganda is reporting an outbreak of Sudan Ebola virus that last occurred in Nyimbwa sub-county, Luwero district in 2012. The last Ebola outbreak in the country, which was in Kasese district, was of the Zaire strain and was imported from Congo in 2019. This outbreak was controlled without any community spread. Actually, this disease may not spread so much because the brief I read was that these first cases in Madudu were first reported on the 6th of August, 6th or something like that, or 5th, 6th. So this is more than a month ago, almost 2 months. And these people just kept quiet at home until this fellow who came to the hospital. So you can see it's not really that, it confirms, because this is 2 months. If it was our other problem, Corona, I think we would be having bigger numbers. But this, the first case, no, is it the one who died? The first who died in the village, whom they kept quiet about. Jen, you explain that.
Those are the 19 whom we didn't test, who had signs and symptoms in the village, but we didn't confirm.
So those are the ones of the 6th?
Yes, from the 6th.
What is Ebola? Ebola is an acute disease caused by a virus and is deadly if left untreated, or if treatment is delayed. It is transmitted through contacts as follows: person-to-person transmission through contact with body fluids from an infected person, such as blood, saliva, sweat, urine, feces, sexual fluids, etc. Contact with objects that have been contaminated with body fluids like blood, feces, vomit from an Ebola-infected person, or a person who died from Ebola. Contact with secretions of infected animals such as fruit bats, chimpanzees, gorillas, monkeys. Eating meat from wild animals found dead or sick, especially monkeys, chimpanzees, gorillas. Those cultures of eating those same humans, because gorillas are like human beings. So why some people eat their relatives, I can't understand. I've got cows, some of our people have got goats. So people, muveko bazita batya? Bazita batya mu Luganda?
kulya amazike.
Amazike, those are gorillas. Naye buno
Enkima.
enkima, muve ku nkima bannange. Enkima si za kulya. Symptoms of Ebola. A suspected case of Ebola may present with any or some or all of the following symptoms: sudden onset of fever, fatigue, chest pain, pain on swallowing, diarrhea, vomiting, unexplained bleeding from any body opening, e.g. ears, nose, mouth, eyes, anus, bleeding from body openings, mouth, nose, eyes, also bleeding under the skin, which is usually a late symptom. This bleeding comes much later. So please don't wait for the bleeding. Start with the temperatures. I think those are the other signs. Temperatures and pain in swallowing. Ebola can be prevented by doing the following. Wash your hands with soap and water, or use alcohol-based sanitizer. Bikole ebyo, those work. Avoid contact with body fluids from any person or animal suspected of being infected with Ebola. Clean all potential contaminated surfaces with chlorine solution. All people suspected or confirmed to have died of Ebola should be accorded supervised, safe, and dignified burial. Report all cases with signs and symptoms to the nearest health facility. History of Ebola outbreaks in Uganda. Several Ebola outbreaks have been reported in Uganda since its discovery in 1976. 2000 Gulu, Masindi and Mbarara, 2007 Bundubujo, 2011 Ruero, 2012 Chibare, 2015 Kasese. Prior to the West African Ebola outbreak, 2014-2016, the Gulu outbreak in the year 2000 was known to be the biggest and most complex Ebola outbreak in the world, with 425 confirmed cases and 224 deaths, including 31 health workers. However, it now ranks number 3 after the West African problem and the DRC 2018-2019 outbreaks. The Sudan Ebola virus is one of the 6 known strains of Ebola. Of these 6, only 4 are known to cause disease in humans: Zaire, Sudan, Bundubujo, and Cote d'Ivoire, Ivory Coast. The first known outbreak of Sudan Ebola virus was reported in 1976 in Nzara, in the then Sudan, now South Sudan, infecting 284 people and killing 151. Since then, there have been 6 outbreaks of the Sudan Ebola virus, with 2 occurring in Sudan, 1979 and 2004, and 4 in Uganda, 2000 Gulu, 2011 Luero, 2012 Chibale, and now 2022. Ebola can be treated. Interventions can be fought. A rapid response team was immediately deployed in the Greater Mbende region to carry out an immediate assessment and support the response. Based on information from this team, the Ministry of Health has classified the country into three risk zones. Category 1, very high risk, Mubende, Chejegu, and Kasanda districts. Category 2, high risk, not very high risk, but high risk. The districts bordering Category 1 districts, namely Kakumiro, Chenkwanzi, Kiboga, Mtiana, Chibale, Kazo, Gomba, Sembabule, and Chenjujo districts. Kampala and Wakiso are also included in the category because of ease of movement and trade. Category 3, the rest of the country. I'm informed by experts that previously handled Ebola outbreaks in Guru, Bundubujo, Chibale, and Ruero have been deployed to Mubende, Kasanda, and Chejego district to manage patients and control the spread of the outbreak. The Ebola treatment unit at Mbende Regional Referral Hospital is currently at 51 bed capacity for confirmed cases and 8 beds for suspect cases. Since most of the Ebola cases are coming from Madudu sub-county, which is the epicenter, government has decided to set up an additional Ebola treatment unit of 30 beds at Madudu Health Center 3. This is to avoid the 30-kilometer distance of transferring patients to Mbende Regional Referral Hospital and to improve early patient care and management. To facilitate this, government will immediately connect Madudu sub-county to the national electricity grid to provide power to the sub-county and the health center. Furthermore, a solar-powered borehole will be sunk at Madudu Health Center 3 to provide running water. Currently, samples are being tested at the Uganda Virus Research Institute in Entebbe with a turnaround time of results of 24 hours. This is not good for the response because time is lost during the transportation of samples. The Minister of Health has informed me that by Friday, 30th September 2022, 2 mobile diagnostic laboratories will be deployed at Mbende district. This will shorten the turnaround time of sample processing and improve timely patient care. Vaccination against Ebola, Sudan Ebola virus. I'm told that there is no approved vaccine for the Sudan Ebola disease. However, there are several vaccines for the Ebola Sudan undergoing trials. The government is exploring all options to get a safe and effective vaccine as quickly as possible. I will update the nation as soon as this becomes available. There is a vaccine for Ebola Zaire, and we have already given it to our soldiers who are operating in Congo. Therefore, one of the issues we were debating the other day was why not use the vaccine of Ebola Zaire, even though it's not specific for Ebola Sudan, but it is Ebola. So some of they share some of the characteristics. And we are discussing that. Why not? And it is safe. We have found that it is safe because people are already using it, and we have used it on our soldiers. So, is there any harm in trying it? We are discussing that. And also these ones which are being experimented for Ebola Sudan. So even if it is being experimented, it can be used. I want to reassure Ugandans and all residents that the government has got capacity to control this outbreak, as we have done before. Therefore, there is no need for anxiety, panic, restriction of movement, or unnecessary closure of public places like schools, markets, places of worship, etc. as of now. That one I have already told you that this disease doesn't need those big measures of closing and restricting movement. Our healthcare workers will do all it takes to save lives and bring the situation under control. I call upon the public to cooperate with the healthcare workers and report anybody with signs and symptoms similar to that, to those of Ebola. So you have heard that really this virus we can fight it more easily than corona, because number one, it does not go through the air, through breathing. The breathing one is a problem. You know this for Senyiga, for this common cold. You sit in the car, even you sit in a room like this, somebody will give you Senyiga, common cold. But this one is not in that group. It's a bit like AIDS. You remember when AIDS came, people were running around, tourists were not coming. Tourists were not coming. I said, but why are tourists not coming? Oh, there is AIDS. AIDS is found in only certain addresses. You don't go there, you don't get it. So how can that be a problem? I told the tourists, if you come here for tourist activities, there is no way you will get AIDS, unless you include non-tourist diversions. But actually, this disease is even easier, and you see how we manage the AIDS. But this one is even easier than AIDS, because like AIDS, it doesn't go through air. So they are the same. No going through air. Number two, doesn't go through a healthy skin. Again, AIDS goes through certain parts of the body. But the difference which makes this one easier to fight is that somebody can have AIDS virus but doesn't show signs, and therefore becomes a silent infector. This one apparently, what I've been briefed, which makes it easier to fight, is that you only become effective when the signs have started coming. Oba kyekyo akawuka tukamaze. We can manage this kawuka. This one is not. Because so therefore, you hear we are talking of